Fighting the new coronavirus has been a battle against the unknown for both the doctors treating those infected and for us. And since our last video on COVID-19, the outbreak has been declared a global pandemic, meaning that the virus has spread over several countries or continents and affects a large percent of the population. The last global pandemic was declared in 2009 when swine flu started sweeping the world. However, it's important to note that a pandemic does not initiate the severity of a disease, only the degree to which it's spreading. So what does that mean for us? Should we all be doing more to stop the spread of this disease? And have our governments been too slow to act? In this video on COVID-19, we will look at what the virus does to your body, what the full range of symptoms are, and who is more likely to become seriously ill or die. We'll also try to wade through some of the data to see if we can establish how much of a threat this outbreak is to the world and our loved ones. As this is an ever-emerging crisis, some of the figures in this video will already be out of date, but we are using them to illustrate the trend of the virus and who is more likely to be at risk. Now, before we get started, we do not want to rant and rave about Patreon, given this topic, but what we do want to say is that we know many of you are going through financial difficulties due to COVID-19. There will be many of you who may be struggling financially over the next couple of weeks or months. And if you enjoy our content, we are not going to let a paywall stop you. Simply email us to patreon@top5s.co.uk and you will be sent an email reply with the links to the documentaries for free. Let's begin. Studies by doctors at the front line of the epidemic in Wuhan, China, have recently compiled a report looking at more than 44,000 confirmed cases of the disease. It showed 81% developed mild symptoms, 14% developed severe symptoms, 5% become critically ill, with more than half of those leading to death. However, as the disease spreads, and it undoubtedly will, these figures will significantly change. In particular, the death rate will lower. More people will be infected, but crucially, more people will recover and become immune. For example, at the start of the coronavirus outbreak, South Korea had the most confirmed cases outside of China, and as of 13th of March 2020, they have 7,979 cases confirmed. But from the start, they have had an aggressive testing program in place, and to date, they have tested over 200,000 people. Of those they identified as infected, early intervention meant only about 10% of patients required hospitalization, while the rest had a strong enough immune system and care information to fight the virus on their own. Nonetheless, 71 people have died, putting their death rate at less than 1%. South Korea's combative action is believed to be the reason why they have managed to contain the spread. We can't help but think that if the rest of the world, in particular European countries like Italy, who are now struggling with over 15,000 confirmed cases, had intervened like the South Korea government did and provided the public with free and easy testing options free of charge, even setting up drive-through testing booths, then this virus could have been contained and we wouldn't be in the situation we are now. But hindsight is always 2020. At the time of writing this, the worldwide death rate sits at anywhere between 3 and 4%. But as has been proven in South Korea, this will hopefully decrease as more cases are identified and more people recover. There seems to be 3 major patterns seen in the clinical course COVID-19 infection. Mild illness with upper respiratory tract symptoms, such as a mild cough and fever, non-life-threatening pneumonia, and the most concerning stage, severe pneumonia with acute respiratory disease syndrome, ARDS. Men and women are equally likely to be infected, however early reports indicate more men have died from the disease than women. Children seem to be the least likely to develop severe illness from the disease, and at the time of writing this, thankfully no child under 9 years old has died from the disease. Although they can still catch it, and without symptoms, could be unknowingly spreading it. Similar to the children, the vast majority of confirmed cases in adults are considered mild, involving mostly cold-like symptoms to mild pneumonia. To contract the coronavirus in the first place, you have to come in direct contact with it, either from an infected person coughing or sneezing near your face, by physical contact through a handshake or kiss, or from touching a surface that the virus has landed on, and then touching your nose, eyes, or face before washing your hands. There is some debate about whether the disease is airborne, and at the time of writing this, there is no evidence it is, but that could change, and if it is proved to be airborne, the virus could linger for a longer period of time than those spread by droplets, and can also be spread in air conditioning and ventilation systems. After becoming infected, on average, it takes around 2 to 6 days for someone to show symptoms, although it's worth pointing out that some people who catch the virus will remain asymptomatic and display no symptoms at all. However, they can still pass the virus on to another human, and that's where it gets tricky. However, for the majority of infected people, COVID-19 begins and ends in their lungs. Because like the flu, coronavirus is a respiratory disease that infects the tissues and airways deep inside the lungs rather than the nose. The first symptoms in most cases is a dry cough and a fever, typically with a temperature of over 37.8 degrees centigrade or 100 Fahrenheit. After a few days, this can progress to shortness of breath and fatigue. Other less common symptoms reported are muscle ache, confusion, headache, sore throat, and rarely diarrhea. Unlike a cold or flu, sneezing and a blocked nose are not common symptoms of COVID-19. If you display any of these symptoms, no matter how mild, you should call your healthcare provider for advice. If you only have mild symptoms, it's likely you will be advised to self-isolate at home for at least 14 days, after which the risk of secondary transmission to others is thought to be low. Even if you feel better before the 14 days, you should still stay away from public areas and not go to work, school, or anywhere where you will be in close contact with humans. Although there have not been reports of pets or other animals becoming sick with COVID-19, it is still recommended that you limit contact with animals until more information is known about the virus. If you contract the virus and contact with people is unavoidable, or you are caring for others, you should wear a mask and cover your mouth and nose with a tissue when you cough or sneeze, and dispose of and wash hands immediately. If soap and water is not available, clean your hands with an alcohol-based hand sanitizer that contains at least 60% alcohol. Also avoid sharing personal household items and clean all high-touch surfaces every day. At this early stage, monitoring your symptoms and staying in touch with your healthcare provider may be all that is required. However, seek urgent medical attention if your illness is worsening and you experience shortness of breath or difficulty breathing. The earliest studies of COVID-19 have shown that many patients develop pneumonia in both lungs, leading to shortness of breath. For most people, this will be present as non-life-threatening pneumonia. At this stage, our body's immune system will kick in, triggered by the presence of the viral invader, and step up to fight the disease by flooding the lungs with immune cells to clear away the damage and repair the lung tissue. When working properly, this inflammatory process is tightly controlled and confined only to infected areas, and a healthy person should eventually be able to fight off the virus and fully recover. However, sometimes our immune system goes haywire, creating a cytokine storm, and immune cells kill anything in their way, including healthy tissue. When this happens, it causes more damage than the initial virus, and even more, debris clogs up in the lungs, pneumonia worsens, and hospital intervention is needed. Cytokines are proteins used by the immune system as alarm signals, and they deliver immune cells to the site of infection. The immune cells then kill off the infected tissue in a bid to save the rest of the body. But when too many cytokines are released and the fight becomes a free-for-all, that's where problems arise, because it's not just targeting the infected cells, it's attacking healthy tissue too, creating inflammation that weakens blood vessels in the lungs and causes fluid to seep through to the air sacs. So in effect, you start bleeding out of your blood vessels, and this spills into your circulatory system, creating systematic issues across multiple organs. From there, things can take a sharp turn for the worst, and in some of the most severe COVID-19 cases, the cytokine storm, combined with a reduced capacity to pump oxygen to the rest of the body, can result in multiple organ failure. Even if a patient survives a cytokine storm, they are often left with permanent lung damage. So what is being discovered is not that COVID-19 is killing people, but rather their immune system's response to it. And this is evidenced by the high proportion of deaths in the elderly and people with underlying health problems. as in both cases their immune systems would not be working as well as a healthy individual. This would also explain why so far there are no serious cases of COVID-19 in children under 9 years old. Children are known to have a straightforward immune response to infections, so scientists aren't sure whether young children just aren't getting infected or their symptoms are so mild that no one notices it. Initial reports from doctors at a hospital in Wuhan reported that 2 infants tested positive for the novel coronavirus, one just 30 hours after birth. Naturally, this troubling headline spread across news organizations, given it raised questions of whether pregnant women can infect their unborn children in the womb, or whether the disease can be transmitted during birth or through breast milk. However, mother-to-infant transmission wasn't observed with SARS or MERS, despite numerous cases involving pregnant women. Plus, it's now emerged that it's highly likely that these babies born into a hospital overrun with infected patients were bound to be at risk of also catching the virus. A new study published in The Lancet suggests there is no preliminary evidence that the coronavirus can be passed from mother to child. While this study doesn't completely rule out the possibility of transmission during pregnancy, it highlights the need to be cautious in speculating about this disease. However, pregnant women have recently been added to the list of people who are considered as high risk of complications if they catch coronavirus. We looked at what can happen to the body if the virus takes over, so let's look at some of the reasons why the virus may get out of control in certain people. Early indications are that those with pre-existing illnesses and the elderly are more likely to suffer serious complications from COVID-19. And this has been confirmed by the first deaths. The first 2 patients to die in Wuhan were seemingly healthy, although they were long-term smokers and that would have weakened their lungs. The first was a 61-year-old man who had severe pneumonia when he arrived at the hospital. He was in acute respiratory distress, meaning his lungs were unable to provide enough oxygen to his organs to keep his body alive. Despite being put on a ventilator, his lungs failed and his heart stopped beating. He died 11 days after he was admitted. The second patient, a 69-year-old man, also had acute respiratory distress syndrome. He was attached to an artificial lung, or ECMO, machine, but this wasn't enough. He died of severe pneumonia and septic shock when his blood pressure collapsed. It's worth remembering that these 2 patients were already extremely ill before they arrived at hospital, and the hospital staff would have had no idea at the time what they were dealing with. However, as knowledge about the disease has increased, there is a definite age demographic that are at risk. These are the latest figures that indicate their chances of death after contracting the disease. Of course, these are not the true death rates, as some patients still being treated may yet die, and many mild cases are going unnoticed. Another factor affecting the deadliness of the new virus is the quality of medical care. Already, there is evidence that the overwhelmed medical system in Wuhan, where the outbreak began, led to more deaths. So hopefully, as medics learn more about the disease and are more prepared to face the influx of coronavirus patients, the mortality rate will lower. The overall death rate for people with no other health problems is currently around 0.9%, but this is likely to lower when everything pans out. However, this rises significantly to those with underlying health conditions, such as diabetes, heart disease, asthma, chronic obstructive pulmonary disease, cancer, cystic fibrosis, primary immunodeficiency, smoking, and dangerously overweight individuals with a BMI of 40 or above. So people in that category have to be extra vigilant regardless of how old they are. Now, although the headlines are alarming and causing many people to panic, for the majority of people, as long as you practice the hygiene steps recommended and follow the guidelines if you do feel unwell, you should be fine even if you contract the disease. It is, however, much more worrying for older people or people with underlying health conditions, as obviously they are more at risk than others of serious complications, and it can be misleading when we read the headlines that seem to indicate if you are not old or ill, you will be okay. But what we have to remember is that won't stop you contracting the disease in the first place. We are all equally at risk of that, and if the younger healthy people then pass it on to someone's elderly mother, father, or dearly loved grandparents, we all suddenly become deeply affected. So, we all have a duty to contain this virus and self-isolate where advised, and take all the necessary precautions to avoid catching or spreading this disease. Being selfish is not an option. The key to getting COVID-19 under control is to be sensible and follow the advice given, and hope the respective governments step up and do the same. As a closing note, we wanted to give a quick medical alert. No one is to use anti-inflammatories, e.g. ibuprofen, Voltarol, naproxen, and many others for pain or high temperature. Use paracetamol instead. There seems to be a link between severe cases of COVID-19 affecting young people with no underlying illness and taking anti-inflammatories. Initial reports started coming from French doctors recently. This has now been confirmed by infectious diseases consultants. We hope you've learned just a few things about coronavirus by watching this video. We feel it's our duty to be doing videos like this, given the amount of followers we have. Stay safe everyone, and as always, we'll see you in the next video.